Welcome to Lyme disease, why antibiotics often fail. Here's your host, Dr. Darin Ingels.
The conventional medical treatment for Lyme disease is 21 days of antibiotics. However, when those 21 days are up, even if you're still having symptoms, your doctor is likely to stop your treatment believing that 21 days is adequate enough to clear your infection. Many Lyme-literate doctors experienced in treating Lyme disease feel that 6 weeks of antibiotic treatment is most appropriate to treating Lyme disease since the organism itself is very slow growing. While most bacteria in your body replicate every 20 minutes, the Lyme organism, called Borrelia burgdorferi, actually replicates every 1 to 16 days, so much slower than the type of bacteria that might cause a sinus infection. Some people end up taking antibiotics for months to years with little to no improvement. And in the course of that, it can kill off a lot of your normal bacteria that live in your gut, which are an essential part of having a healthy immune system and being able to fight off infection naturally. Up to 80% of your immune function comes from your gut, making these good bacteria an essential part to having a healthy immune system. Long-term antibiotics can also cause kidney and liver damage, as well as many other harmful side effects. As a doctor, I've witnessed the damaging effects of long-term antibiotic use, including nausea, vomiting, diarrhea, chronic abdominal pain, headaches, worsening fatigue, and insomnia on people who've been treated for months to years. And I had similar symptoms when I was being treated with antibiotics. Some of the new research suggests that Lyme has become resistant to a lot of the antibiotics that are commonly used to treat Lyme disease. Some of these Lyme organisms are called persister cells, and they've developed clever ways to alter hundreds of their genes to survive antibiotics. These persister bacteria seem to grow at even a slower rate than other Lyme organisms, giving the antibiotics less time to actually help eradicate these bugs. If you have acute Lyme disease, taking antibiotics is appropriate and can help eradicate the infection and prevent it from causing further damage to your body. According to the CDC, up to 20% of people with acute Lyme disease will fail antibiotic therapy and go on to develop chronic Lyme disease. The evidence for using antibiotics with chronic Lyme disease hasn't been very encouraging. Some studies have found no benefit with using antibiotics long-term in Lyme disease, while other studies found any improvement was lost shortly after stopping the antibiotics. If you've been on the roller coaster of antibiotics and have not improved, then it's time to start looking at other options. I've been on that roller coaster and I know what it's like, but I want you to know that you have options. In my book, The Lyme Solution, I share what I use to treat myself and thousands of my patients. You'll learn how to eat the right foods, improve your gut health and immune system, detoxify better, enjoy deeper, restful sleep, and use novel therapies to modulate your immune system. Consider me your online health coach, and I'll help you overcome Lyme too.
To learn why antibiotics often fail, and for your copy of immune-boosting recipes, visit DarinIngelsND.com.